Welcome to it's a second event in a series of 3 for the end of Ambition for Ageing. And this one, we will be highlighting some of our findings from a process evaluation from Supporting Ageing in Place, and also launching the report. I'll just do a bit of housekeeping. So if you can, I mean, everyone's on mute, but if you can stay on mute until we go to the breakout rooms, and then that'll be a chance to have a chat, and there will be a chance for questions later in the seminar. Please, if you've got any questions going through, put them in chat and I'll get to them when I can. We are recording, you'll have had to say yes to that, but we will be recording the seminar. And if you can put your cameras on, it's really nice to see people's faces, especially in breakout rooms as well. That's, when you're in a smaller group, it is really nice for people to be able to contribute. And there'll be a couple of breakout rooms. So yeah, it's good. It's so good to, it's really exciting to have this. We've been working on Supporting Ageing in Place for the past 18 months, and Dr. Luciana Lang has been working on the process evaluation for the final from April last year. So to be at this point where we're able to share those results with you, it's really exciting to see what's going to come from this. And we based our Supporting Ageing in Place programme on learning from the previous 5 years of microfunding and delivered it ourselves. So without further ado, I'll hand over to Luciana, who will be presenting the findings.
Thank you, Thea. Thank you very much. Thank you, everyone, for being here today. It's my absolute pleasure to be part of this celebratory set of events that Ambition for Ageing is having as it comes to a close. And I must say my experience was really, really rewarding. So I'm going to share my screen, and hopefully there won't be any hiccups on this, just because we don't have a lot of time, because I want to present and we want to have a discussion with all of you, because this is about exchanging learning. So this is really important to have your views as well and your experience of working and liaising with Ambition for Ageing. So I was, as Thea mentioned, I was hired to do a process evaluation in last April. So I started in May to look at this amazing work that Ambition for Ageing has done over the past 7 years. And to start with, I had to go through a little bit of the first 5 years to then focus on the work of Supporting Ageing in Place. So therefore, my work, basically the report that some of you may already have seen that has been disseminated this morning, it's got a little bit of the legacy of Ambition for Ageing before focusing on the work of Ambition for Ageing, of Supporting Ageing in Place itself. So I think most of you are familiar with the work by Ambition for Ageing, but for those who don't know, there is an extensive collection of reports on the website which reflect not only the enormous scope of Ambition for Ageing's reach in terms of supporting community projects, but also the talent and professionalism of the team and of the individual researchers who collaborated with Ambition for Ageing over the last 7 years. And I must say, for me, it was a hard act to follow, because there were some amazing work conducted by my colleagues like Sophie Yarka, who focused on social infrastructure during her period with Ambition for Ageing, Camilla Lewis, Tina Buffel. So it was really hard going for me in terms of keeping the standard of work. And there is a number of relevant insights in the reports that have been produced by Ambition for Ageing over the years, and the links for it are in the report that was disseminated to you. And some of these insights informed the evaluation process. Yeah, so when I started to design how to do this evaluation process, I was drawing on some of those insights that had already been presented over the years. I will point to them during the course of this presentation. So in this slide, there is just some numbers just for you to have an idea, for those who don't know, of the scope of the work of the program supporting aging in place and all the microfunding, other types of funding that Ambition for Aging did over the years. So really key, I think, is the set of values and approaches that Ambition for Aging has adopted over the years. And it drew on related academic research. Yeah, so right from its onset, one of the premises that Ambition for Aging had was that inequality is a major driver of isolation. In other words, people from low-income neighborhoods have more barriers in terms of making connections, and hence the commitment to some of these core values and approaches that you see on this slide. And what the process, makes salient is that these values and approaches can help individuals to have greater access to social capital, which is a key concept to understand the importance of relationships to promote resilience, especially in a moment of crisis, as we have seen with the COVID. And I think it is, in a way, it's like a blessing in disguise. Well, you can hardly say it's a blessing, but I think there was even more learning with Ambition for Aging, with having to work in the aftermath of the COVID crisis. And also in terms of just going back to this idea of social capital, which is really important. And there is some reports from Ambition for Aging, and maybe Lucy can later put some links on that talk specifically about the concept of social capital, which some of you may not be familiar with. So just as a reminder, the reports is one of them is called Developing Social Contact Models in a Time of Social Distancing, and also an overview of the social capital. So these are both very relevant reports on this subject. Now, there's been a number of strands in Ambition for Aging over the 7 years, and microfunding was one of them. Yeah, so that included, so generally speaking, the microfunding programs were about small pots of money, like 2K. In some cases, even smaller pots of money, like in the case of Including One Small Thing, which was 500 quid. And there were also programs with larger pots of money, as in the case of the scaled programs. So there is, again, the numerous reports that Ambition for Aging produced gives you some insight on these different strands. But let's go on to the support and aging in place, which is the focus of the work of the evaluation that I did since last May. So this was a place-based program, and it focused on some particular neighborhoods of Greater Manchester. I'm not going to go into detail about the selection of those neighborhoods. You can find out more when you come to read the report. But in terms of my research, it's my research itself. Yeah, so I wanted to just mention some of the challenges that I had as I was, hired to do this work. So it was not only a matter of, I couldn't just go straight into evaluating the process of Support and Aging in Place program in 2021, because of some of its core values. And namely, I want to call attention to the test and learn core value that Ambition for Aging is committed to. Because of this approach of learning through process, it means that I could not evaluate the 2021 program without taking into account all the learning that had happened before that. Yeah, so I had to also do an overview of the legacy to come to, you know, to understand the scope of this legacy of Ambition for Aging. Was really important to know what learning was incorporated in 2021 and what were the limitations of the test and learn approach, if any. Also, there was, I am an anthropologist of green spaces, so I have a personal interest in green community projects. So I suppose that in a way it was a challenge, because that was always a desire, personal desire, to focus a little bit on the work that Ambition for Aging did related to green spaces. And I touched on it on this report, and I am hoping that over the next few weeks, I'm going to have some time to actually produce just a small guide on the green community projects that Ambition for Aging supported in 2021. So in terms of my learning in the field, yeah, so as an anthropologist, I had the chance to visit projects and see what 2K, what the difference that 2K can make to community groups. I was talking to and learning from all actors involved, and that means, you know, the team, the Ambition for Aging team, the communities, the stakeholders, the many partners, including, for example, MAC, the Older People's Network, Pride in Aging, which was in a way a baby of Ambition for Aging, because it was supported in its onset by Ambition for Aging, but it became a group in itself. And the LDLs that worked in different years with Ambition for Aging. And it was very fruitful, these conversations, these connections made. And I was particularly inspired by this interdisciplinary exchange that the research enabled. So in terms of, so I have separated this presentation into findings related to the methods and also the findings related to the process itself. So I think qualitative research provides a unique insight into how connections can be fostered because of this bird's eye perspective that you get by visiting projects, by talking to different people. As an anthropologist, we work with communities, we research communities by spending time with them. And whilst I wasn't able to spend long periods of time with the communities I visited, I did have a privileged perspective on the efforts by individuals in community making. And I'm going to talk a little bit more about that later. So I also sort of wanted to just talk a little bit about the insights that I had through the data collection. So this is not findings from the process evaluation, but insights that I gained whilst I was collecting data. Yeah. So so one of the key things I think is just like I can only have praise to the test and learn ethos of Ambition for Aging, because it does translate into more horizontal relationships, yeah, between all parties. And it also means that there is an ongoing improvement of design as the learning feeds back into the process. Yeah, so this was very clear from not only during the process evaluation, but actually, talking to people to gather information, to gather data. Another key insight was the role played by the local infrastructure organizations, which in a way I wasn't liaising with them directly because of the position that I was in, but I was able to do some focus groups with them. So that sort of elicited very interesting insights that you can see, that you'll be able to read in the report. And the protagonist role by older people, yeah? So not only as partners, as in the case of the Older People's Network, the amazing work that older people are doing as members of the Older People's Network, but as project leaders as well. So this was actually quite, inspiring, I must say. And last there on that slide, I have an item which is about the limitations of co-production. And I think I talk a little bit more about this in the report, but is this awareness that co-production, it can be an ambiguous concept, and not everyone really knows what co-production entails. And we have to be very aware, funders, people who are delivering projects, organizations in general, to avoid tokenism, in a sense, to make sure that this idea of co-production is not just a box-ticking exercise where you put older people just to say that older people are there taking part, but co-production is more than that. Yeah, so it has to be active. It's got to be, people have got to come out of the experience of co-production with a sense of autonomy and agency. And also there's some projects that perhaps cannot be co-produced. So the limitations of co-production is about sort of really exploring what it means, rather than just using it as something that you put there to, to tick the box. In terms of the finding of the process, I'm going to sort of try to finish within 5 minutes, because we want to go into breakout rooms and find out your take on things. So this is just like a snapshot of some of the findings, and I'm going to talk about some of them. In this slide, I want to focus on this idea of how important it is for people to be able to connect and network, and the importance that makes in terms of at the organizational level. Yeah, so being able to connect and network is not just important at the individual level, but for the sustainability of projects in the longer term. So the next slide relates to illustrates this importance of being able to connect and network. So I have here the example of 2 projects, one of them in Gorton, the other one in Reddish. And you'll be able to look at those slides in more detail when they are shared later on. But I'm just to illustrate this, in the case of the Men in Sheds, this was an organization that was struggling a little bit with networking. And then it just so happens that in a bike sale event, they managed to connect with another organization, local organization, and that really sort of marked a new start for the sustainability of that organization. This was a very small grassroots organization. And also the importance of social prescribing, and this is the one that I want to focus here on this slide. I want to look at 3 particular findings, and I'm going to illustrate that with some case studies. So I want to look at the importance of social prescribing, the attention that dispersed communities are not left out of place-based programs, and the importance of social infrastructure. So these were really important findings, and I'm going to quickly try to illustrate why, yeah, with those case studies. So this is a case study in Rochdale. So it's called Get Up and Grow, and the project was funded by Ambition for Aging to do some pottery classes. Now, it just so happens that the person in that CIC, in this organization is ICIC, has a very good relationship with the library. So they were able to use the library space to do these pottery workshops. And I thought this was absolutely remarkable, because while I was there visiting the project, you know, children came from a local school to visit, and they saw, you know, the older people making some pots in this corner at the library, and it was all very kind of done in a quite an informal way, with a really you know, lovely sense of conviviality between, you know, the staff working at the library and, you know, and the people working in the project. And it was just like, I thought it really illustrated well what social infrastructure can be, and the difference that social infrastructures can make in a community. This next example of walk and talk, this is a walking, is a project related to green spaces, but I think this particularly illustrated particularly well the importance of social prescribing, and how social prescribing can make a difference not only to members of a community who may be kind of on the margins, but also for those running projects who sometimes may have difficulty in recruiting participants. So in this case of this project, they had a relationship with the local doctor surgery, and they were having the people sort of sent to them to go on these health walks, you know, and that was running really well for a few months. And it looks like it's going to be sustainable in the long term. And then a final one that I want to put here before we go into the breakout rooms is one that focuses on dispersed communities. Now, I'm not going to expand too much on this topic. There is some, I talk a bit about dispersed communities in the report. But on the 23rd of March, there's going to be another event of this series of Ambition for Aging celebration events. And Claire is going to introduce to you the work that she's been doing with dispersed communities. But basically, these are communities that sometimes may not be adequately addressed with place-based programs, right? Because they are communities of identity or belonging, and they are sometimes, they refer to people that may have to travel to meet other members of their communities, yeah? So in the case of the dispersed communities, this was really, the visit to this project was really insightful, in the sense of me getting an idea of how these grassroots organizations are acknowledging the needs and the particular needs of dispersed communities. And in this case, Ambition for Aging was able to support them with this fantastic work about memories, people's memories, and how people got together from different places in North Africa in this organization in Salford, and they were putting the photographs and the narratives of their lives through this project of memories. Yeah. So on that note, we are going to go into the breakout rooms, and there's two particular questions we are going to address in the breakout rooms, and it would be great to hear from you. Yeah, to hear. So one of them is how, well, the facilitators are going to ask you if any of these insights resonate with your experience, whether as a project leader, as a funder, or as a community member. Yeah, so if any of those insights sort of makes you think, yes, you know, perhaps, you know, social prescribing would be really useful in my case. And the other question that we have for you is whether you have a story of connection to share. So thank you very much. I'm going to do a little bit, another bit of presentation after the breakout rooms, but I'm going to leave it to Lucy to work her magic to put us into the breakout rooms now. Thank you.
We've only got a couple of minutes for feedback, so I'm just going to pick a couple of people. Ellie, can you give us some highlights from your breakout room, please?
Yeah, so we were having a bit of a chat about social prescribing, and there was some discussion around whether voluntary organisations, particularly the smaller ones, are properly supported to be able to sort of deliver some of these things. Seeing that they're, you know, a lot of them are best placed and with the work that they do, but how accessible the funding is for them to do these things, and yeah, whether they've just got the time, the resource and the resilience for them to be able to contribute to it as well as they can in the current sort of structures around it.
Thank you. Yeah, that, I mean, echoed. We had conversations as well about the power of social prescribing as well, and older people taking part in activities. Sharon, can you give us a highlight?
Yes, she knows I talk on. I think the thing that's important to say is that it's really resonated with a lot of people within the group, and a lot of the groups and the areas had similar impacts as project leaders or as participants. And interestingly, the work has really created and galvanised interest and demand, and that's almost been exponential. Again, it's highlighted the real importance of social infrastructure and those community spaces. I think another comment was that this piece of work kind of worked better than perhaps some other pieces because it was more structured and more focused in the areas and helped create greater connections. And actually it's created, so Mark was talking about Rochdale, it's created sort of connections out of areas, so with Bury, so they can kind of share learning. And Steph from Bury was sort of saying that as a result of this work, they've kind of looked at it and learned from it, and they've actually set up an older person's co-production network there. And they're actually looking at how they can apply these lessons to reach more diverse communities. And final one, it was kind of sort of said, you know, the importance of qualitative, I can never say that, research, and actually how engaging and getting people to tell their stories helps show and highlight and helps create connections.
Yeah, absolutely. I think when it, you know, we're so lucky on the Ambition for Ageing programme to be funded enough to have a full-time researcher who was able to go out and do that work. I wouldn't say it's not challenging at times, you know, when as a team you're working to deliver a funding programme and then you're getting feedback about that and the changes that you're making. Sometimes, you know, it can be challenging to have that, but actually what we did was learn from it and be able to improve and make changes as we went, with it being a test and learn programme. Right, I'm going to hand back over to Luciana. I don't know if you want to give any feedback, Luciana, or just continue with your presentation, because we're just about on time at the moment.
Yeah, I do want to give some feedback because I think there was something very relevant that was talked about in the group that I was in, and that was about the new challenges posed by COVID in the post-COVID scenario. Yeah, with people struggling to come out, losing skills sometimes, losing confidence, and because of that, there is a new need for investment in social infrastructure, which we have already talked about, but in things like transport. So I think this was really important because we are going to talk about this, and also about the new challenges related to mental health, people's mental health in this post-COVID scenario. Okay, thanks. That's great. Anybody? There's no other feedback, is there?
I think we just need to move on, and if we can, if we've got some time at the end after this next breakout room where we can pick up anything that we've not said now.
So share my slides again, and so am I sharing that? Is that all right?
Yes, that's fine. Yeah, we can see that.
Good. So let me just do something here. Sorry, I'm trying to do something and okay. So so what I'm going to focus on these last 10 minutes of my presentation.
We can see notes, by the way.
Sorry?
We can see your, it's not just the main slide.
Right, okay. Okay. So yeah, so I'm going to share with you some of the solutions, right? So because in the report we talk about, you know, potential solutions, recommendations, etc. But for this presentation, I want to focus on the solutions as suggested by our participants, yeah. So by people who were in the community projects, people I interviewed, and people who took part in the focus groups. So there was a lot of talk about the need to share networking activities, and the need to share the learning through networking events. Yeah, so some participants also suggested this idea of a directory of organizations and activities at neighborhood and Greater Manchester levels, so that organizations know what's happening elsewhere. To avoid doubling of activities, but also to invite more collaborations between different organizations. I'm not going to look at all of them, but I want to also remark on this idea of green social prescribing, which, you know, as a researcher of green spaces, I hadn't come across. So that was something that I learned through talking to participants, that, you know, there is this new idea of green social prescribing, where you, the social prescribing happens connecting people to green spaces or activities in green spaces. Be they, you know, walking in green spaces or doing art, you know, and craft workshops in green spaces. So so again, I think this highlights the remarkable contribution that participants have given to, you know, to the legacy of Ambition for Ageing. Now, sustainability. And here I'm using the concept of sustainability, not just in the more usual environmental context, but sustainability in terms of projects and organizations being sustainable over the long term. Yeah. So this was one of the focus that the report has a section on sustainability, and we, in our conversations, my conversations with the team at Ambition for Ageing, we thought that this was something that we had to mention and include in the report, because it's really important for organizations to be able to sustain in the long term. Because, for example, you start a project and, you know, you get funding for perhaps, you know, 3 months of delivery, and then what happens after those 3 months? So, you know, so these people start coming and they become, you know, they have some kind of a shift in their lives, because they are again connecting with people, they are engaging with activities they like, and then that comes to an end, and then what happens to it? So, so we were looking at what were the mechanisms through which some organizations were more able, better able to be sustainable in the long term. Yeah. So, and a few of insights were gained on that sense. And I'm going to talk briefly about some of them. So creativity is actually quite important. So some individuals, some project leaders are very creative in the way that they find to carry on with projects, sometimes with modifications. So again, I have an example here from Manning Sheds, where they were doing, so that the first project that they got funded in 2021 was about repairing bikes. And then they were left with lots of bike pieces that they had no use for. And so by, you know, through talking, connecting, you know, and doing a bit of networking, the project leader got in touch with an artist who then started doing some workshops of creative work with bits left over by bikes. And that ended up being another project that, you know, took them through another 3 months of activities. So this is an example of how creative means can be quite vital. And this is, of course, is down to, you know, to individuals' efforts and persistence, as in the case of Ryder Brow, you know, and again, the project leader goes around asking for things, and she managed to get a new polytunnel into the land, into the allotment, and through that she was then was able to apply for funding for another project that happened inside that polytunnel. But also really key for this sustainability over the long term, and sorry, I just wanted to stay here still, is related to the space and how people can access space in the sense of a venue, a place where they can hold their activities. And this can be really, so if you are a new grassroots organization with, you know, don't know a lot of people in the area, that could be really draining in terms of your funding, because you may spend so much of your funding actually using to pay to hire a venue. And then, for example, that it may be that when you hire that venue is not really suitable. For example, a participant was saying that they hired a church venue, yeah, for the activities, but some people didn't feel comfortable doing activities inside churches. So this can be an issue really that can particularly affect new groups, yeah. In being sustainable in the long term. Now, something also really important in this sustainability over time is the local knowledge, yeah. So people's local knowledge, and I give this example of Gina Daycare Center, because they've been around for almost 2 decades, right? And through that time, they have being able to have oh gosh, I'm running out of time again. So they have transport. They were able to secure funding to give transport to people, right? So this again was something that a lot of participants talked about in the post-COVID context, that people are reluctant to go out and are reluctant to take public transport. So the fact that the Gina Daycare Center was able to provide transport for these people made all the difference in terms of keeping the rooms busy with people and people coming in the rooms. And then I'm going to now move on to recommendations. And so these recommendations are geared towards policymakers, basically, yeah. So this is at a kind of a higher level, a more local authority level. Some of the recommendations that were resulted from this evaluation. So capacity building became a really important finding in this evaluation. The need for capacity building to strengthen groups and enhance their sustainability in the long term. Yeah. Also the need to address the dispersed communities and their particular complexities, in the sense that, you know, they may be related to English as a second language. It may be related to the need for particular funding for transport because they live away of their communities of identity. The need for systematic efforts to exchange the lessons learned between organizations. So this we found so important, because there is all this learning, all this local knowledge that is there, all this amazing work that is being done, and this is not necessarily showcased enough and is not necessarily shared enough. So the need for, at the level of local authorities, to have some systematic effort to exchange those lessons learned, and perhaps produce something like a directory to promote networking. And local councils have a key role in aggregating this information and promoting opportunities for the exchange. so the need for investment in social infrastructures, which we have talked quite a bit about today, and to systematize social prescribing. So there's more recommendations in the report, so you can take your time, and I'm really sorry that the report is so long. I did have to edit quite a few pages out because I was, severely instructed to do so. But on that note, we are going to go into breakout rooms again, and the question that we want to ask from you is, how have you or will you incorporate learning from Ambition for Aging into your work? Thank you, Lucy. So we are ready for it.
Everybody back now. We've got another group. Is everybody on mute? It sounds like there's a bit of feedback. So yeah, I mean, some really interesting conversations there in our breakout room. We're not going to necessarily do feedback from each of the rooms, but I just wondered if anybody has any questions or any comments. We'd love to hear from you. If not, I'll start picking on people.
Can I pose a question, please, that came up in our group?
Yeah, sure. Is it Kim?
Okay. Yeah, it is. Yeah. Basically, I had posed the question with the social prescribing, especially the idea of moving towards green spaces, which we've seen has been very impactful in our area, that we struggle to kind of understand the link between when somebody is socially prescribed something, where does that go, and how do those people then understand what is happening in their communal areas that they could get involved in? So, if there's a creative program going on or an outdoor activity, and someone's gone to the GP and requested or been prescribed some sort of social activity, I don't understand personally how that works. I don't think there's enough information in our area, at least, that explains how any of that works. And we had a conversation about how training takes place, but then what actually happens to the people who are trying to access those services, and how do they link up with what's actually going on in their communities to get involved in things? So my question was to everybody, does anyone know how that process works, or which organizations kind of oversee that, or if they could signpost me to how that all happens, or that would be really helpful.
Luciana, I don't know if you know the answers. I mean, I'm guessing, so social prescribing will be set up differently in different places. And yeah, I think, Luciana, can you add to any of that from the experience you've had just on our programme?
Yeah, no, I think my answer to Kim is that my main finding on this is that nobody knows. It's that very few people. It's almost like a well-kept secret, and that somehow we have to find the key to this which seems like a fantastic idea. And the walk and talk project was the one that I see it's working there. Yeah, so there is a system in place. But what I found is that there is no systematic approach to social prescribing, or if there is, I couldn't find it. So Kim, I think this is a very good question, and I think that is work waiting to be done out there about how to systematize this.
And there are link work, and also through Aging Better, a lot of the partnerships did social prescribing in different ways as well. So you also have voluntary sector organisations delivering a type of social prescribing. So yeah, there's no true answer for you there, Kim. I don't think that'll probably help you there, but some people got hands up. So Russell, I don't know if you've got something to add to that.
Yeah, I was going to answer the question that Kim asked. There are centres for volunteering throughout the country, and they do have a list of a lot of voluntary opportunities in the local community. And certainly your local council, they should also be able to help. But if you're looking at, which we're doing now mainly through COVID, if you want to get involved in stuff that's online, if anybody subscribes to Eventbrite, you can actually bring it right down to your area. So you can just have like Manchester, and that will give you a list of organisations that are presenting like you are today. And there's an organisation called Murphy that's really growing. My wife's a retired teacher, and she's done it now for about 12 months. And they do talks, they do Pilates, yoga. My goodness, they do all kinds of things. She's on there more than she's talking to me now. So that has been great for her, because she's found that replacement for what she used to be doing before COVID, which was going out and meeting people. And she's got this online group of people. So there's Murphy, Centre of Volunteering, and certainly Eventbrite. Kim.
Sure, and also your local infrastructure organisation, depending on where you are.
Yeah.
Has anyone else got any questions about the research or anything that came up in the breakout rooms that you'd want to share with us? Where's Claire? Claire, you didn't get a chance to feedback last time. Have you got anything to share?
Well, it's interesting because social prescribing came up in our first breakout room in the context of talking about the non-uniformity of it, and how there's some places where social prescribing has barely been heard of until recently. There are some housing associations that have been doing it for a long time, but others that have never engaged with it. It's a whole new thing. And I think that's reflecting what Luciana was saying about how there's no one way to do it. There seems to be no one model for it, or no one single process that's rolled out absolutely everywhere, absolutely the same way. And it seems to be more of a kind of concept that is used to signpost people as appropriate and as needed in different areas, but in some areas, again, the effectiveness or the availability of social prescribing processes, I would imagine, would also depend on the social infrastructure in the area, the assets available. So I would imagine, and I would speculate on the basis of what Luciana has been saying and on what other people have said, that areas with possibly lower income areas are going to have fewer assets, and therefore social prescribing might be more needed, but maybe less available or less comprehensive. But it may also be that sort of higher income areas don't have a recent history of social prescribing. It's quite new there because there's so much possibility for people to just find their own stuff. And communities may be thriving, maybe there's a lot of assets and people are linking up in informal ways already as it is. So I think it would be interesting, maybe we're raising something here in terms of another investigation to actually look at what is social prescribing, why is it different everywhere, how is it different, what are the factors and elements involved in those differences.
Yeah, thank you.
And that was certainly something that came up.
Claire from last week is the Aging Better is putting out an evaluation paper on social prescribing connector models. So there's a link there for when it comes out. Jackie, you've got your hand up. Do you want to ask a question? You're on mute.
Yeah, here we are here. Yeah, it was just to add to that, if you like, because it's a bit like the soap in the bath thing about engaging with social prescribing, because we've got it in our area. It's run by the local infrastructure. I think it's doing good work with individuals. It's us as a group. This is a chat and brew for and activities for people who are socially isolated. Just sort of actually forming a bit more of them people knowing us and people being introduced into it. Just need to get over that barrier, the connecting, the actual physical connecting. I think that might be, obviously COVID came in the way. Site change of personnel quite often, maybe the people that they're actually working with need more support to get into our community-based thing than we're actually offering at the minute. So we're back to that again. And that's what I picked up on the presentation at the beginning, the importance of that for some people, just to do the beginning bit while people are recovering or feeling, back into the community after social isolation due to COVID, etc. So yeah. we haven't quite done it. Sort of all there, but we haven't quite connected.
Yeah. I think, and we were really bowled over by people who wanted to connect through those projects, and people doing it in different ways, especially for those who didn't feel comfortable meeting up face to face. Claire, you've got your hand up.
Yes, sorry about the applause, Jackie. I mean, what you said was really great, but I wasn't meaning to press the applause button. You don't feel too picked out there. But something that's come up, and I can't remember where this came up, but it was in the last few years, so it was definitely through Ambition for Aging work, was a concern about the capacity of groups, maybe like Jackie's. I wasn't not entirely clear what the group is that you're describing, but the capacity of groups to accept a prescription into the group, if you see what I mean. So it's one thing to sort of signpost people or link people and say, yeah, go along to this group, go along to that group. That is something actually I do remember now, the conversation where it came up in with some local delivery workers in about 2018 or 19. And there's some concern about whether all of the groups getting prescribed into were actually able to take all of the newcomers coming in, whether they were able to accommodate the increased demand for connection into those groups. And so there's always going to be a need for sort of local specificity, and it's going to be about subtlety and nuance and building relationships, and those link workers being supported. They have to be be connected to an infrastructure that will support them to not prescribe sometimes where that's not actually appropriate, and so on, and to support groups to take new members into them. Yeah.
Thank you. Roxana, we've got a minute left, so.
Oh, okay. It's just a saying. It takes when you're young, one person can look after 5, but when you're at the other end of the scale, it takes 5 people to look after the older person, the elder in the group. So that's kind of what it takes. It takes a lot more of us to do that connecting and being there for each other.
Yeah, thank you. It's nice to meet you. I know we've funded you through supporting agents.
Yeah.
Luciana, have you got any final comments?
Yes, I do. Yes, well, first of all, I wanted to ask Lucy if it's possible for you to share the chat, later, because I think that would be really helpful if you could share the chat with everyone. So, and I wanted to say my thanks, which I should have done at the beginning of my presentation. My thank you very much to the Ambition for Aging team, this amazing team, bunch of professionals. And to Chris Phillipson, my mentor, and to all the community participants and community leaders that helped. So thank you very much for everyone. And then just the last point that again, in the last group that we had came up the topic about the transport. Again, how important it is for more funding to be allocated to transport people in this aftermath of COVID, because people are so reluctant to go out. So we need extra motivation for people to come out and join community activities. So, and that's it. Thank you very much, everyone, for being here. It was a pleasure. And please do read the report and send us questions if you have any.
Yeah, and I'll just echo those thank you to you, Luciana. You've been absolutely dedicated on the process evaluation and the whole team behind supporting Aging in Place. There will be a good practice guide coming out that will complement the report. So we will send that out once that's completed, and then in the chat I've put the link in for the event again, which is on the 23rd of March, and that's our research on dispersed communities. So thanks for everyone coming along today. Hope you've found it useful.